To meet the individual needs of our clients at Neta Care, we go through a process when we onboard a client, collecting information through a care planning process. So the care planning process is essentially where we sit with them on the first day of, they've signed a service agreement, they want to go with us. We sit with them and we go through and map out a big profile for them. Now, we might already have access to a bunch of clinical documentations that we would use to map out the journey. We have a questionnaire kind of document that we go through, and we would have filled out most of those. That gives us a really good perspective of who the individual is and how do we meet their needs and achieve their goals. So when we meet with them, we're really kind of confirming a lot of what we found, a lot of what we've read, and that's a very key component to really being able to genuinely understand how to holistically serve a person. It's one thing to have the information, it's another thing for that person to go through the process of, yes, that's it, that's me, that is the problem. Actually, no, I find that I'm feeling different symptoms these days. And we ask a lot of questions that really gets the person thinking about who they are and what goal they wish to achieve through our service provision. And through that, as we go through that process, we end up, because the person who does that is usually a clinical practitioner themselves, usually a nurse, we end up discovering through that process that actually if we incorporated, say, a speech pathologist into your care model, or if we incorporated an occupational therapist into your model, then we can start to see some of the outcomes that can effectively get you the goals and outcomes you're looking for. And once that starts, part of the work piece for that service delivery clinician or manager is that they then formalize everything they found and all of the information they found through a simplified model so that their direct care worker can look at that and go, I know exactly how to support you today. I know what kind of language you like. I know how you like to be interacted with. I know what your goals are. I know even your cultural, your linguistic, your religious practices. We deep dive into those things so that, because you know that we are actually providing an everyday care for you. We are spending a lot of time with you in your life and then trying to ensure higher quality of life for you. And through that process of support, we actually look at their everyday post-support, whether you're meeting with a clinician or a direct care worker, we actually go through a process where daily we look at what happened during that day, what the experience looked like, and we use that to shape and improve the information that we use to then care for you. So it's a very full circle approach that, we might find something through a reporting that we go, hang on a second, looks like we need to get you connected to one of our doctors because there's something that is going on there, which you wouldn't typically get from your stereotypical service provision, that they will go through a case note, identify something that's telling us we need to get another clinician involved here. We catch something early, which I call the proactive healthcare, as opposed to a more passive healthcare model, which is you wait till it's really bad and then we treat the symptom first and then try to get to the root cause. Typically, we can identify root causes very early through our model as well.